Hello friends, today we will discuss about intellectual disability and its types. Intellectual disability is identified by significant limitations in intellectual functioning as well as adaptive behaviors. Mental retardation is defined as significantly sub-average general intellectual functioning associated with the significant deficit or impairment in adaptive functioning, which manifest during the developmental period, that is before the 18 years of age. General intellectual functioning is usually assessed on a standardized intelligence test as well as adaptive behavior scale. Persons with mental retardations vary in their behavioral, psychological, physical, and social characteristics as much as the so-called as normal general population does. In addition, mentally retired individuals are at greater risk of exploitation and physical as well as sexual abuse. The prevalence rate is intellectual disability as an overall general population's prevalence of approximately 1% and prevalence rates vary by age. Prevalence for severe intellectual disability is approximately 6% out of 1000 populations. So 1 to 3% of the general population has mental retardation. The word learning disability or intellectual disability is used instead of to avoid pejorative connotations associated with the word mental retardations. The intellectual disability disorders, the criteria are like this. Intellectual disability is a disorder with onset during the development period that includes both intellectual and adaptive functioning deficits in conceptual, social, and practical domains. They are deficit in intellectual functioning, deficit in adaptive functioning, onset of intellectual and adaptive deficit during the developmental period. The types are mild, moderate, severe, profound, other mental retardation as well as unspecified mental retardations. The mental retardation are conditions of incomplete development of the mind, which is especially characterized by impairment of skills manifested during the developmental period, skills which contribute to the overall levels of intelligence in the children, and that is cognitive, language, motor, social abilities. Retardation can occur with or without any other mental or physical conditions. So degrees of mental retardations are conventionally estimated by standardized intelligence test so far that we are using. Intellectual functioning or abilities and social adaptation may change over time, and however, poor may improve as a result of training as well as rehabilitations. Diagnosis should be based on the current levels of functioning. The mild mental retardation is, in general, the behavioral, emotional, and social difficulties of the majority of mental retarded, and the needs of the treatment and support arising from them are more closely to those found in people of normal intelligence than to the specific problems of the moderately and severely retarded. An organic etiology is being identified in increasing population of patients, although not yet in the majority. So likely to result in some learning difficulties in the schools, can independently work as well as contribute good deeds to the society. So if the proper standardized IQ tests are used, the range would be 50 to 69 is indicative of mild retardations. This includes feeble-mindedness as well as mild mental subnormality. The moderate mental retardation is individuals in this category are slow in developing comprehension and use of language, and their eventual achievement in the area is limited. So achievement of self-care and motor skills is also retarded, and some need supervision throughout life. Progress in schools, work limited, but proportions of these individuals learn the basic skills needed for reading, writing, and counting. The IQ would be usually in the range of 35 to 49. This includes moderate mental subnormality. The severe mental retardation is, this category is broadly similar to that of moderate mental retardations in terms of the clinical pictures. the presence of an organic etiology and the associated conditions. Most people in this category suffer from a marked degree of motor impairment or other associated deficit, indicating the presence of clinically significant damage or maladaptive of the central nervous systems. The IQ range would be seen between 20 to 34. So this includes severe mental subnormality as well as severe oligophrenia in the children. The profound mental retardation is the IQ in this category is estimated to be under 20, which means the practice that affected individuals are severely limited in their ability to understand or comply with the request or instructions given by the caregivers or given by the teachers or given by the parents also sometimes. So most such individuals are immobile or severely restricted in mobility, incontinent and capable at most of only very rudimentary forms of non-verbal communications. The IQ usually under 20. So here comprehension and the use of language is limited to at best. Understanding basic commands and making simple requests also. So this includes idiocy, extremely stupid and profound mental subnormality also. So other mental retardation is this category should be used only when assessment of these degree of intellectual retardation by means of the usual procedures is rendered particularly difficult or impossible by associated sensory or physical impairment as in blind, deaf, mute and severely behaviorally distorted or disturbed or physically disabled people. So the unspecified mental retardation is there is evidence of mental retardation but insufficient information is available to assign the patient one of the above categories. That includes mental deficiency that is otherwise specified, mental subnormality as well as oligophrenia not otherwise specified mental retardations. Yes, thank you.